Hello, my name is Creger, and this is my benchmark for EXS335. In this, I will do a motion analysis of a single-legged squat and a standing overhead press with a mock client. I will do some biomechanical breakdown with some concepts we've done this year. Next, I will do a performance evaluation, and then I'll finish it with a functional analysis where I'll talk about kind of next steps for what I saw in this video. Thank you so much.
My name is Colton. We're going to be doing a single leg squat first. So with single leg squat, what you're really going to want to focus on is keeping your foot within your base of support. That's kind of the circle around yourself under your mass. And when you start, you're going to have your hands on your hips. You're going to lift the other leg, and you're just going to kind of feel where you are in space, making sure you have good balance. And then you're going to go down, keeping your eyes forward, fixed on something still, and have your knee track forward. We call this a sagittal movement because everything is moving in the same direction, forwards and backwards. So could you do one for me, please?
Yep.
Just forward. Perfect. Yeah, to your level of comfort. Push up. Could you do 2 or 3 more for me on that left leg?
Sure.
Thank you, thank you. So yeah, this is gonna work the front muscles. Those are your knee extensors, your quadriceps, and it's also going to work your hip extensors on the back, which are your quad or your glutes, and then some of those stabilizers in your ankle joint. Could you do a few on your right leg for me, and I could watch a few of those?
Yep.
Thank you. Yeah, and small changes like that are totally fine. That's just your body recorrecting, making sure that you are standing upright. Yeah, those are great. Thank you so much, sir.
Of course.
Gotcha. Hello, Roman. For our second exercise, we're going to do the standing overhead dumbbell shoulder press. So what you're really going to want to do, again, is keep those feet outside shoulder width apart, just maintaining a good athletic position. And then you're going to raise these dumbbells up to a 90-90 right here. And you're not going to want to be shoulders completely back. You're going to want to put them a little forward. We call that horizontal abduction. And so when you're at 90, you're going to press up and then come back down. And then we're going to have a 2-0-2 tempo. So we're going to go 2 up, 1, 2, 1, 2, 1, 2, 1, 2. And so you're going to really feel that in the front of your shoulder. The muscle that goes over that is called your deltoid. In the front, we call it just the anterior deltoid. That looks great. You want to bring those elbows slightly forward. Perfect. And you're going to press up. Awesome. And bring it back down. Yeah, those are great. Yeah, let me look on the other side. Yeah. You could do 5 more of those for me.
Yep.
Yeah, this is working the anterior posterior axis of your shoulders and is going to really help with muscle building in upper extremities. Just a few more. Right. And that's perfect. You can put those down on that table. All right, thank you very much. Of course.
Before we did those assessments, I took a few ranges of motion that I felt were pertinent to this movement using a goniometer. We used knee extension, hip flexion, dorsi and plantar flexion, and then for the upper body, we did shoulder flexion and extension. I also did a few handheld dynamometer tests. They were the same as the active range of motion tests. I did all but ankle dorsiflexion only because that's an eccentrically controlled motion in the single leg squat. Following up with the range of motion and muscle tests, we did a static posture analysis. In the anterior plane, we saw that the knees, feet, hips, and neck were all in a proper alignment. However, there was slight right shoulder elevation, and this could be caused by overactive levator scapula or upper trapezius. Next, in our lateral view, we saw that this individual was properly aligned in all the same joints, except he had some slight over knee flexion, and this could be due to tight or overactive hamstrings, causing some shortening of the knee. And finally, in the posterior view, we see that there's a few more insufficiencies. First, the right shoulder again is elevated, caused by that upper trapezius or levator scapula. The knees are slightly adducted or valgus, and that could be the adductor complex, the pectineus, adductor magnus or longus or gracilis. And then finally, there was some left lateral flexion in the neck, and this could be caused by short overactive sternocleidomastoid or the scalenes. Going over our biomechanical principles, for the single-legged squat, it happens in the sagittal plane in the lateral medial axis. The forces that are external are gravity pushing down on the body. The internal forces are the quads, glutes, and those working together to raise your body up and down. And then finally, our ankles are second-class lever, the knees and hips are third-class lever. For the standing overhead press, the plane is the frontal plane with the anterior-posterior axis. The forces that are internal are your anterior deltoid, your triceps, and your rectus abdominis, keeping your body upright. And the external forces are the weight that you're holding and the gravity on your body. And then the levers are all third class except the second class in your ankle. When looking at the force velocity curve of these two movements, we know that these are both movements that are low in velocity and so therefore high in force production. Both of them in the concentric would produce less force than in the eccentric, which is common for most movements. Next, we're going to look at the active and passive insufficiencies. For the single-legged squat, we know that the rectus femoris is a hip flexor, but also a knee extender. And so while you're going down, there's going to be active insufficiency as it is shortening up top and lengthening on the bottom. We see active insufficiency in the triceps brachii for the overhead press. And then for our passive insufficiencies, there's the hamstrings because they are hip extensors and knee flexors happening in two different motions, and also the biceps brachii for the overhead press. Then finally, we're going to look at the length-tension relationship, and this mainly came in our muscle strength measurements. This is because we put the muscle in a neutral position whenever testing for strength, because we know that optimal actin myosin cross-bridge formation is where we produce the most force and get the best test of a muscle's capability. The important motor learning principles that are discussed in these two movements are that they are both closed loop movements, where they are occurring without the need. The motor learning principles that are most emphasized in these two movements are one, that they're both closed loop movements, meaning that they rely heavily on feedback, and our body is going to use its proprioceptors to determine the changes that are going on and use that as information to correct balance and posture. Next is that we're to provide concise feedback that is specific, that allows them to understand what is important and not overweigh them with extra information. Next, we make sure that they're in proper zone of arousal for training. In my client's situation, we were very early, and so that could have impeded his performance. And finally, environmental context, mainly for the single-legged squat, only because that requires a lot of concentration. Having a very loud or noisy environment with a lot of stimulation may challenge them to do the motion correctly or safely. I'll be assessing these movements in accordance with the ACSM guidelines for the two motions. For the single-legged squat, you want to have your knee tracking in between the second and third toe. While the client did a very good job, there was quite a bit of knee instability with some hip hiking, and on the right side, the hip turned in. For the shoulder press, and for the single-legged squat, I'm giving a 7 out of 10. For the standing shoulder press, there was very little to critique, maybe some slight shoulder elevation, which would lead to scapular instability, but I'm giving the client a 9 out of 10. On the left side, we saw knee valgus and also a hip hike. The knee valgus could be caused by a weak medial hamstring, glute medius, or vastus medialis oblique. Also, the hip hike could be caused by weak adductor complex on the same side or glute medius on the same side. For the right leg, we also saw knee valgus, which are the same muscle weaknesses, but the torso began to roll inward, which would lead to internal obliques on the opposite side and external obliques on the same side of the movement, and also some glute medius weakness. As I said earlier, the overhead squat was done with really good form. However, there was slight shoulder elevation, which could lead to tight upper traps or levator scapula, or weak lower traps and mid traps that are preventing the scapula from being pulled down. Again, comparing these to what you'd hope to see in the movement, The single-legged squat did have some instability and did not follow perfectly what the ACSM guidelines are, so it'll be an acceptable movement. However, for the overhead press, it was excellent with only the slightest shoulder elevation seen. And then prioritization of faults. First, we're gonna make sure they're operating in a safe, pain-free range of motion. Next, we're gonna focus in on major form defects. Then we'll look at things like external extra rotation or shoulder elevation that would impair the movement but aren't dangerous. And then finally, the minor things like small tilts and corrections that occur in novice trainers but leave as soon as you become expert and train those motions frequently. For my functional assessment for the single leg squat, while there was some instability, the strength was there for really good reps on each side. So I would say this athlete is ready to go back to training and continue in athletic activities. For the standing overhead press, clean and efficient movement was present, and so they're able to continuously load this lift heavier or increase the frequency. When looking to improve this movement, there are 4 main ways that we're going to do that. First, we would strengthen our weak muscles, those being our VMO, glute medius, or lower or mid traps. Then we would want to lengthen or inhibit overactive or tight muscles such as our upper traps, our hamstrings, or our lateral neck flexors. Then we would want to focus on the feedback and instruction that we give, making sure that it's concise and effective so that they can focus on only what's important. And finally, we would modify the movement, making it more challenging if they are able to overcome the challenges they've already had, making it more effective and increasing strength, speed, and power. Thank you so much for your time and watching this presentation.